Hey everyone. Let's talk about something that's often overlooked but absolutely vital for us as medical interpreters: body language. Sure, we're trained to listen to words and translate them accurately, but when we step into a hospital room, there's a whole conversation happening without a single word being spoken. Let me give you an example. Imagine you're interpreting for a patient from Bulgaria. The doctor asks, "Are you feeling pain?" And the patient nods. Most of us would assume that means yes. But in Bulgaria, nodding actually means no. If I'm not tuned into these cultural differences, I could completely misunderstand what the patient is trying to say, and that could change their treatment. Now, it's not just about translating words, it's about reading the room. I've seen doctors who really get this, even if they don't speak the patient's language. They make eye contact, they lean in, they have open hands. And sometimes, it's those gestures that build trust faster than anything I could ever say. There was one moment I'll never forget. I was interpreting during a tough diagnosis, and I could see the patient's shoulders tense up, their hands clenched tight. The doctor noticed too, and instead of pushing forward, she paused, softened her tone, and even mirrored the patient's posture for a second. Suddenly, the patient opened up. They shared a fear they hadn't mentioned before. That moment unlocked the path to the right treatment, all because the doctor and I were paying attention to something unspoken. But here's the thing, body language isn't universal. Just like spoken language, gestures, eye contact, even how close you stand. All of this changes depending on where someone comes from. In some cultures, looking someone in the eye is a sign of honesty. In others, it's disrespectful. If I don't know the difference, I might miss something crucial, or worse, create distance when I'm trying to build trust. I like to think of us as cultural bridges, not just language bridges. Empathy and cultural sensitivity are as important as knowing the right medical terminology. When I tune into body language and explain those cues to the medical team, I'm not just helping the words get across. I'm making sure the patient feels seen, heard, and understood. And sometimes that's the difference between life and death, or between trust and alienation. So next time you're in that room, don't just listen, watch, notice. And remember, our job is about so much more than words. It's about connection,